Hello and welcome to the ARIIA Knowledge and Implementation Hub Tour video. My name is Virtual Steph and I will walk you through this priority topic, palliative care and end of life. ARIIA's Knowledge and Implementation Hub provides access to evidence and resources on a range of priority topics for aged care. Palliative care and end of life is one of the 10 priority topics identified by the aged care sector via a survey that was conducted by ARIIA or consultations with industry bodies. Alongside palliative care and end of life, other high priority issues include rehabilitation, reablement and restorative care, meaningful lifestyle activities, mental health and well-being, urgent and critical needs, social isolation, clinical governance, technology and aged care, staff burnout and dementia care. Palliative care aims to improve the quality of life of people who have been diagnosed with a life-limiting illness, as well as their families. Person-centred care delivered within this context helps identify and address individual needs and can involve managing symptoms and providing physical, psychological, emotional and/or social support. In Australia, the provision of palliative care and end-of-life care will be shaped by the New Age Care Act 2024 for the rights of older people, and in particular, Outcome 5.7, palliative care and end-of-life care of the strengthened aged care quality standards. The strengthened quality standards will come into effect later this year on the 1st of November 2025. Palliative care within an aged care context can be provided in many different settings, for example, hospitals in a person's home or residential aged care. A multidisciplinary palliative care team can include different healthcare professionals, social, community and aged care workers, Aboriginal health workers, and informal carers such as family members, friends and volunteers. People with more complex care needs can also access specialist palliative care services. This video will introduce you to some of the evidence-based content available on this topic within the Hub that can help support your practice within aged care. When visiting the palliative care and end-of-life topic within the Hub, you will notice that there are similar sections or elements that consistently feature across all the priority topics. For an introduction to the topic of palliative care, you can click on About Palliative Care to learn more. Under the Palliative Care and End-of-Life Evidence and Resources section, you can access the Scoping Review Summary that highlights core evidence themes that were seen in the literature, relevant and practical palliative care resources identified from an environmental scan, which have also been compiled in the resource collection of the Hub. For those wanting to upskill and learn more about palliative care and end of life within aged care, accessing the variety of relevant resources can support your own professional development needs. Further down the page, you can then browse through each of the evidence themes for palliative care and end of life in more detail. There are 5 themes that are spotlighted within the topic: advanced care planning, acute care transfers, communication at end of life, place of death, and staff training and education. Let's explore one of the themes. If you click on the link to learn more about the place of death theme, for example, you will notice that key points are spotlighted at the top of the page. Each of the accordions then goes into more detail by bringing together evidence relevant to the particular question or subheading. One of the key points is that people are more likely to die in a home setting if they are supported by a multidisciplinary palliative care team. Aged care services in a home care setting also play an important complementary role to support care provided at the end of life. The new end-of-life pathway, available as part of the Support at Home program, coming into effect from the 1st of November 2025, will help to facilitate improved access to in-home aged care services. Access to this funding for those who have been diagnosed with 3 months or less to live means that aged care services can be put in place to support older people who wish to stay at home at the end of their life. Recognising end of life is therefore also critical. Ultimately, increased aged care service provision will also have an impact on workforce capacity. From a care perspective, advanced care planning and the importance of having conversations earlier on can help plan for what palliative care and end-of-life care will look like for the older person and the care team involved. The role of advanced care planning also highlights the interrelationship between the evidence themes within the context of palliative care. To navigate from one evidence theme to another within the topic, you can also do this via the menu on the left-hand side of the page. When it comes to advanced care planning, what we know is that only a small proportion of Australians in aged care have the chance to talk about their end-of-life care wishes and have them documented. Staff training, knowledge, skills, and confidence all have a part to play in how well advanced care planning programs are implemented. As you work your way through the content via the accordions on this page, it may help answer some questions you might have around the effects of advanced care planning for aged care residents, topics that may be discussed as part of advanced care planning conversations, and factors that facilitate the uptake of advanced care planning. There are also points on what individuals as well as organisations can do. Don't forget, you can also download each theme as a PDF via the button featured near the top of the respective theme web pages. Given our ageing population, it comes as no surprise that staff training and education has been identified as an evidence theme for palliative care and end of life. For those who are working or training for palliative care-related roles in the aged care sector, there are a few ways you can find resources within the Hub to help you work towards meeting your own learning, development and practice needs in this area and applying new knowledge to practice. If you are undertaking your own research in this area or are just interested in what may be available, we have provided an easy connection to a PubMed search designed by a qualified evidence synthesis librarian to show you the published literature in this area. The PubMed search feature can be found across all evidence themes and topics in the Hub. As you scroll through, you will come across a selected resources section, which is a curated list of resources relevant to the theme. Here, under the Staff Training and Education theme, you can see links to e-learning modules and toolkits as a few examples. To view the larger collection of resources on the topic, click on Browse Palliative Care and End of Life Resources. You can search by topic, care setting, audience, and by choosing more. You can also filter these results by content type and source. After watching this video, we hope that you feel more confident in navigating the information and resources on palliative care and end of life that are available in the Hub. As you can see, our researchers have brought together content from different sources to provide you with some of the top themes from the evidence base on this topic. More evidence themes for palliative care and end of life will be added soon. Watch this space and check back in to learn more about the topic. You may also be interested in reviewing the other aged care priority topics featured in the Knowledge and Implementation Hub. To keep in touch with ARIIA updates, subscribe to receive the ARIIA Notebook monthly newsletter.